Imagine taking the exact software architecture used to teach someone how to code online, right? And then just using that exact same tech to run a mass vaccination site at Dodger Stadium.
In the middle of a global pandemic, no less?
Yeah, in the
Ugh.
middle of the pandemic. I mean, it sounds completely absurd. You wouldn't think an e-learning platform has like anything to do with emergency medical triage.
No, you really wouldn't.
Yeah.
But the traditional, the analog tools were just failing so spectacularly at that point.
Right.
So a radically different technological approach was really the only way forward. It forces this total reevaluation of what a medical network actually is.
Because when you step into the wider world of the U.S. healthcare system, you're immediately confronted with this, well, this structural landscape that is just totally siloed.
Oh, absolutely. Siloed, frustrating, and, I mean, for millions of people, fundamentally inaccessible.
Right. It operates way more like a collection of walled gardens rather than, an actual cohesive network designed to keep you healthy. So welcome to today's deep dive. We are so thrilled you're here with us. Today, we are looking at how technology is being leveraged to essentially tear down those walled gardens, right? To re-engineer this broken U.S. healthcare system and make it accessible and equitable for you.
Yeah, and we're pulling our insights today directly from presentations and detailed transcripts featuring Claire Hough.
Who is the Chief Technology Officer at Carbon Health, right?
Correct. And our mission today is to extract the actual blueprint of a tech-driven healthcare future.
Yeah.
We're, moving entirely beyond those Silicon Valley buzzwords to examine the actual operational mechanics.
We want to see exactly how data interoperability and, proprietary applications are practically saving lives.
And rescuing doctors from administrative collapse on the ground, which is huge.
Okay, let's unpack this. Because
Yeah.
I am just intensely curious about how you even begin to tackle a systemic problem of this massive scale.
It's a massive undertaking, yeah.
I mean, re-engineering U.S. healthcare while it is actively functioning or, malfunctioning, it sounds like, trying to swap out the engine of an airplane while it is actively falling out of the sky.
That is a perfect analogy.
Mm-hmm.
What's fascinating here is the foundational mindset that actually initiated this specific operational approach.
Right, because historically, healthcare in the U.S. has struggled deeply with equity.
Yes, and the quality of care is just wildly inconsistent depending on your zip code. But Carbon Health approached this by applying an e-learning mindset to the medical field.
An e-learning mindset.
Yeah, and that specific architectural philosophy is what fundamentally changes the game here.
Okay, let's dig into what that actually means technically, because that framework comes directly from their founder, Aaron Bali, right?
Exactly. So Aaron Bali founded Carbon Health back in 2016. But prior to stepping into the medical arena, he was actually the founder of Udemy.
Oh, wow. The e-learning marketplace.
Right. It's massive. They serve over 50 million students globally.
I mean, Udemy is ubiquitous. But what makes an e-learning platform scale to 50 million users isn't just, like, video hosting.
No, not at all.
It's the back-end database architecture.
Right.
Right? Tracking millions of individual progress states seamlessly. It's modular, it's asynchronous, it's designed to be universally accessible to anyone with a browser.
And that is the crucial connection. The entire mission of Udemy was taking high-quality education, digitizing the delivery mechanism, and making it available instantly.
Right.
So when Bali exited Udemy and analyzed the U.S. healthcare system, he saw the polar opposite of that.
He saw the walled gardens.
Exactly. Highly localized physical bottlenecks where underserved communities are just consistently being left out.
So he realized that if you could build a software stack to track the educational health of 50 million students,
You could theoretically build a system to track the physical health of a population with that same, seamless, borderless efficiency.
that is an incredibly ambitious vision to have back in 2016. But, I mean, any theoretical software model eventually has to meet reality.
It does. And for the entire global medical system, that reality check was obviously the COVID-19 pandemic.
Right. And before we can even grasp the mechanics of Carbon Health's technology today, we have to look at what happened to their infrastructure during this period.
Because it was the ultimate test.
Yeah. At the very start of the pandemic, Carbon Health only operated 6 physical clinics. Just 6, nationwide.
Which is a remarkably small physical footprint when you consider the tidal wave that was approaching.
Unbelievably small. But Unfazed by that lack of physical infrastructure, they leaned immediately into their e-learning DNA, right?
Yes. Organize the information first and make it universally accessible.
So their very first major move wasn't even clinical, it was informational. They built a comprehensive nationwide digital index of all the COVID-19 testing sites.
And the utility of that, I mean, it cannot be overstated. In those chaotic early days, if you typed COVID testing near me into Google, you were almost certainly looking at their proprietary index.
Wait, really? That was them?
Yeah. Google's algorithms recognized the structured, highly organized data that Carbon Health had compiled and just ranked it as the top result.
Wow. So they basically solved the information bottleneck before they even touched the clinical bottleneck?
Exactly.
But they did eventually pivot to the clinical side, and they specifically targeted what we'd call healthcare deserts.
Right, places like East Oakland and the Bayview District of San Francisco.
Areas that historically lacked adequate medical facilities. And they just started rapidly deploying these pop-up clinics.
Yeah. And as the months progressed into June of 2020, their operational capacity really grew. Businesses, government agencies, school districts, they were all desperate for safe reopening strategies.
Sure. Everybody was trying to figure out how to get back to normal.
Right. Carbon Health responded by engineering these mobile testing teams that could deploy on-site to these organizations, effectively creating decentralized clinics wherever they were needed.
But the narrative takes a massive leap in December of 2020. I mean, this is the moment that forces a complete stress test of their software.
The Los Angeles situation.
Yes. The city of Los Angeles reaches out. LA is facing a catastrophic crisis at this point, enduring roughly 1,500 COVID deaths a week.
It was devastating.
It was. And the city asks Carbon Health to help roll out vaccines at scale. Within just 2 weeks of that initial request, Carbon Health transforms Dodger Stadium into a massive vaccination hub.
2 weeks. Transforming a sprawling baseball stadium into a highly regulated medical facility in 14 days requires, like, a logistical synchronization that most municipal governments struggle to achieve in a year.
Let's talk about the mechanics of that scale, because going from running a handful of clinics to managing Dodger Stadium overnight,
It's unheard of.
in traditional IT terms, that's not like an indie band suddenly playing a stadium. That is like a small local website suddenly getting hit with Super Bowl level server traffic.
Right. It's a massive concurrent data spike.
Yeah. If you just throw 500 iPads at volunteers and tell them to start registering patients, a legacy database is going to lock up entirely when hundreds of people hit submit at the exact same second.
Oh, it would crash instantly.
So how did their entire IT structure not just buckle and crash under that weight?
Well, if we connect this to the bigger picture, the pandemic acted as a tragic but absolutely flawless proving ground for the software architecture they had been quietly building since 2016.
So they were ready for the traffic.
Exactly. The underlying reason the system didn't crash is because they bypassed traditional medical software entirely.
Ah.
They were utilizing their own proprietary provider and patient applications, which were built on modern, auto-scaling cloud infrastructure.
Oh, so literally the exact same way an e-learning platform dynamically scales server capacity when 1 million students log on for a test at the same time.
That is exactly it.
That explains the sheer volume they were able to handle. I mean, scaling from 6,000 initial appointments to processing 26,000 appointments across 7 different sites.
It's incredible.
They vaccinated over 1.5 million people in just 4 to 5 months.
And that volume is staggering. You know, they didn't achieve that by magically hiring thousands of administrative workers in 2 weeks.
Right.
They achieved it by deploying software designed to ingest, process, and route millions of data points simultaneously without the need for manual human transcription at every single step.
But vaccinating 1 million people is an incredible feat that inherently creates a massive data bottleneck.
Always.
If those doctors and nurses had to chart those 1.5 million individual visits on a standard legacy medical system, the administrative backlog would have taken years to clear.
Oh, decades maybe.
Which forces us to look closely at what Carbon Health's technological stack actually is, and what were they replacing? What is the status quo of medical software?
So the status quo in traditional healthcare is heavily fragmented.
Right.
Hospital networks, private clinics, independent labs. They generally use entirely different database systems.
And they don't talk to each other.
No, these systems are notoriously walled off. The data does not talk freely. And at the absolute center of this fragmentation is the Legacy Electronic Medical Record System, or EMR.
The infamous EMR. This is the clunky software the doctor is perpetually clicking through while they're sitting with you in the exam room, right?
The very one.
Just looking at their laptop instead of making eye contact with you.
Yeah, because legacy EMRs were fundamentally designed as digital filing cabinets for billing and insurance coding.
Wait, they weren't built for patient care?
No, they were not built to optimize clinical workflows or deliver highly coordinated patient care. It was all about billing.
That makes so much sense.
Right. So when Aaron Bali evaluated these existing market options, he deemed them structurally incapable of supporting a modern, equitable healthcare model.
So what did it do?
They made a highly unusual and expensive decision. They engineered their own proprietary EMR stack from the ground up.
Meaning they built a closed-loop system, a proprietary app for the clinical providers, seamlessly connected in real time to an app for the patients.
Yes. And the sources note over 1 million downloads of this patient app, boasting an 80% usage rate among their active patient base.
80%.
Yeah, an 80% adoption rate for patient-facing medical software is remarkably high. Most patient portals see a fraction of that engagement.
Okay, here's where it gets really interesting, because I have to push back on this adoption metric.
Okay, let's hear it.
Look, you and I both have a dozen health, wellness, or fitness apps sitting on our phones right now, just gathering digital dust.
Guilty as charged. Yeah.
App fatigue is a very real psychological barrier. Furthermore, getting patients to proactively input complex medical history or, fill out digital forms before they even arrive for an appointment sounds like a massive UX hurdle.
It does.
Why aren't patients simply ignoring the proprietary app and demanding to fill out paper forms at the front desk? Why does another app actually stick?
It is a vital question. To understand why patients actually adopt it, you have to look at how the software actively removes friction for both the patient and the provider simultaneously.
Okay, how so?
Well, the patient app is intrinsically tied to access. It allows you to secure same-day urgent care appointments. But the true magic happens with the pre-visit questionnaires.
Right. The sources claim these digital questionnaires save 5 to 10 minutes in the clinic. But how exactly?
Because of data mapping. In a legacy system, you fill in a paper clipboard, you hand it to a receptionist who manually types it in.
Usually with one finger.
Right. And then the doctor has to reread it and navigate 20 different drop-down menus just to log your symptoms.
It's so inefficient.
Very. But in Carbon Stack, when you tap "My throat hurts" and "I have a fever" into the app from your couch, that data maps directly into the provider's specific clinical templates.
Oh, wow.
The database auto-populates the medical chart before you even walk through the clinic doors.
So the doctor isn't starting from a blank screen, but you're simply verifying the data you already submitted, which drastically cuts down their manual keystrokes.
And that leads to the most critical operational shift in this entire deep dive. In traditional systems, doctors spend literally hours after their shift doing what is universally referred to as pajama time.
Pajama time. That sounds cozy, but I'm guessing it's not.
It's terrible. They go home, eat dinner, and spend their evenings doing administrative data entry into clunky EMRs. It is the leading cause of severe physician burnout nationwide.
But because Carbon Health's patient app feeds directly into those optimized provider templates, the data entry is essentially happening concurrently with the visit.
Yes. The result is that Carbon Health providers only spend an average of 20 minutes after hours charting. Total.
Wait, 20 minutes total?
Total.
Going from hours of pajama time to just 20 minutes is a staggering reduction in cognitive load. And this is the actual deduction here. This answers my pushback about app fatigue.
How so?
Because the app isn't just a flashy portal to view your lab results. It functions as a digital shield against physician burnout.
Precisely. When the physician isn't exhausted by administrative bloat, when their evenings aren't consumed by data entry, the quality of care skyrockets.
Because they're actually present.
Yes. The doctor sitting across from you has the cognitive bandwidth to actually look at you, listen to you, and practice medicine rather than practicing data entry.
Re-engineering the software stack clears the administrative debris so genuine human connection can happen in the exam room.
Exactly.
Fixing that in-clinic experience is a monumental step. But once you've freed up the doctor's time and optimized the physical visit, you run into the next logical frontier.
Which is?
How do you manage a patient's health when they aren't sitting in front of you? I mean, healthcare shouldn't just be restricted to a 15-minute exam room visit twice a year.
It really shouldn't.
Which brings us to the concept of the living blueprint pushing data-driven care directly into the patient's home.
Yeah, Carbon Health recognized that managing chronic conditions required a presence outside the clinic walls. So they launched home-based care programs, overseen by primary care physicians, targeting widespread issues like hypertension and diabetes.
The mechanics of the diabetes program are particularly fascinating to me.
Oh, it's brilliant.
When a patient enrolls, they don't just get, like, a generic pamphlet. Carbon Health sends a continuous glucose monitor, a CGM, directly to their house.
Right. And the patient attaches this small hardware device, which tracks their blood sugar levels continuously, 24/7.
But the hardware is only half the equation, right?
Exactly. That CGM transmits a continual stream of blood glucose data directly back into the Carbon Health app.
Okay.
And simultaneously, the patient is required to actively log their food intake, their meals, their specific snacks, as well as their daily exercise routines within that same app.
So what does this all mean? The best way to visualize this mechanism is to compare it to a really robust financial budget tracking app.
Okay, let's explore that framework.
Think about the traditional healthcare model. It is very much like going to a strict accountant once a year. The accountant looks at your annual statements and yells at you for being in terrible debt.
You need to eat better.
Exactly. They tell you your A1C numbers are bad and you need to eat better, but you have absolutely no idea which specific purchases over the last 12 months actually ruined your budget.
Right, you don't have the granular data.
Was it the daily coffee? The car payment? The lack of data makes course correction impossible?
It's an entirely retrospective, highly punitive model of care.
But combining the CGM data with the app's food logging creates a real-time budget tracker.
Right.
The app pings you and says, hey, that specific $5 purchase you made at 2 p.m., that specific handful of pretzels you just ate, that is precisely what spiked your glucose and put you in the red today.
And that provides an immediate visceral connection between your daily behavior and your internal biology.
It allows for instant, actionable course correction.
And that real-time feedback loop generates astounding clinical results. By showing patients exactly which variables spike their blood glucose, 80% of the patients participating in this diabetes program achieve normal blood glucose levels within roughly 6 weeks.
80%.
80% in 6 weeks.
Reversing those metrics for 80% of a patient cohort in just 6 weeks is, that's life-altering.
It really is.
But primary care and chronic management are still only pieces of the broader healthcare puzzle.
Sure.
Eventually, a patient's needs will exceed primary care. You might need a cardiologist or a dermatologist. And historically, securing a specialist referral is just a logistical nightmare of phone tag, lost faxes, and endless waiting.
It regularly takes 2 to 3 months just to get in the door of a specialist.
Right.
Carbon Health recognized this interoperability failure and launched Carbon Health Connect. They are basically building direct partnerships with external specialist networks.
But how do they actually bypass the wait times? You can't just ask a specialist to work faster.
No, you can't. It comes back to the structured data.
Okay, explain that.
Because Carbon Health has already compiled organized, high-quality, standardized clinical data via their proprietary EMR, they can package that patient profile using standardized APIs, application programming interfaces.
Okay, so they're talking computer to computer.
Exactly. They transmit a clean, instantly readable data package directly to the specialist's system.
Oh, wow.
The specialist doesn't have to spend weeks gathering records or requesting new preliminary labs. The pristine nature of the data transfer fast-tracks the referral process, dramatically cutting down those massive wait times.
This raises an important question, though.
What's that?
How does one company collecting all this highly structured data actually benefit the macro ecosystem? If Carbon Health is just building a better, faster silo for their own patients, it doesn't solve the national crisis.
It's a crucial distinction to make. They are explicitly not hoarding this data.
They aren't.
No. They are applying advanced data science and artificial intelligence models to the aggregate, anonymized patient inputs across their entire network.
Okay, so they aren't scanning your personal private messages. They're looking at macro-level symptom trends across geographical regions.
Precisely. If thousands of patients across a specific zip code suddenly start logging low-grade fevers and dry coughs into the pre-visit questionnaires on the app,
The AI sees it.
the AI detects that regional symptoms spike instantly, often days before those patients even physically arrive at a clinic for a lab test.
That is wild.
Right. Carbon Health utilizes this predictive modeling to identify early outbreaks or variant surges. They are effectively operating as an early warning radar system for the wider medical community.
predicting where the strain on local hospital networks will occur before it even happens.
Exactly.
And the sources are very clear on their ultimate objective here. The CTO explicitly states their goal is to share these technological frameworks, these APIs, and these predictive learnings with the broader healthcare industry.
They want to upgrade the operating system of the entire U.S. medical landscape, not just dominate their own market share.
It brings the narrative full circle back to that original e-learning mentality.
How so?
Well, you don't engineer a massive, scalable software platform just to educate one single classroom. You
Right.
build the infrastructure to elevate the standard of learning universally. Carbon Health is trying to elevate the standard of care universally by proving that the data architecture actually works.
That's a great way to frame it.
This has been a profoundly eye-opening look at what happens when technologists stop accepting a fragmented, broken system as just the way things are.
It really has.
We have covered immense ground today, tracking the evolution from the high-stakes logistical pressure cooker of Dodger Stadium to the quiet, vital relief of a physician completing their administrative charting in just 20 minutes.
And we always want to ensure we anchor these concepts back to you, the listener.
Absolutely.
Why does understanding the architectural decisions of a chief technology officer matter to your everyday life?
Because the transcripts we unpack today highlight a fundamental tectonic shift in what your personal healthcare is going to look and feel like in the near future.
The future of your well-being isn't about sitting reactively in a sterile waiting room, flipping through outdated magazines when you are already terribly sick.
Right. It is shifting into an active, continuous background process.
Yes.
Your healthcare is becoming a connected digital ecosystem designed to flag a slight blood sugar anomaly on a Tuesday afternoon, allowing you to correct it before it ever escalates into a catastrophic trip to the emergency room years later.
It is about engineering a system that finally empowers you with your own real-time biological data,
While simultaneously freeing your physician to focus their expertise entirely on healing you, rather than wrestling with outdated data entry software.
which leaves us with a fascinating and highly provocative final thought for you to consider.
Yeah, we've established that this new blueprint can reduce a doctor's charting burden to 20 minutes.
And we've seen that integrating continuous home-based data tracking can help 80% of enrolled diabetes patients return to normal glucose levels in a mere 6 weeks.
So if this proactive, decentralized, tech-driven care truly becomes the ubiquitous standard,
What is the fate of the traditional hospital model over the next decade?
it forces us to question the necessity of our current physical infrastructure. If the underlying software network becomes the primary arena where monitoring, diagnostics, and preventative healing actually happen,
Will the massive, sprawling physical hospital complexes we rely on today become largely obsolete?
we started today talking about how much we instinctively trust the clean physical visibility of an X-ray machine, but maybe the physical hospital itself is simply an outdated piece of machinery.
That's a huge shift in perspective.
Perhaps the most effective cure we have moving forward is the invisible, highly optimized digital network connecting us all. Think about it. Thanks for joining us, and we'll catch you on the next Deep Dive.